area on your body to show signs of serious conditions like diabetes and cardiovascular disease. Here to explain more, please welcome Dr. Robert Parker with Victory Healthcare's Foot and Hand Pain Center. All right. We are hearing more and more about this thing called neuropathy. We're seeing it on commercials and things like that. And so what exactly is happening in the foot, when or in other parts of the body as well, when we say that word neuropathy?
Neuropathy, actually, neuro means nerve, of course, and pathology is a pathological or disease state. So neuropathy is a disease state of the nerve, and it's manifested by symptoms that everybody knows today.
Yeah, symptoms like?
Burning, tingling, numbing, an aching pain. Really, people have numb feet, and they still say that their feet hurt, even though they're numb. It's kind of it seems like it's contra, but it's not. It's very painful.
Yeah, and different things can cause that. Diabetes, again, is one of those things that can lead to neuropathy.
And we have to ask ourselves how we get here. You don't go to bed one night and wake up with diabetes. It starts out with a condition we call metabolic syndrome. That's not a illness, but it's a finding. It's a basket with several things: high blood pressure, increased cholesterol, increased triglycerides, history of diabetes in the family. That means that you have enough. Any three of those put you in that basket of being a metabolic syndrome patient. What's happening with that patient is that the nerves are starting to swell. They're becoming diabetic. And so when nerves start to swell inside the tissues, and we have these fibroosseous tunnels, then what happens, there's a sugar that changes from regular glucose to sorbitol. It's kind of a technical thing. With diabetes, we all know that. And then when you've got these fibroosseous tunnels that are not expanding with that nerve, then you're becoming compressed, and the whole thing is a compression issue.
And that can be the pain and the numbness and the tingling.
Exactly.
You know, a lot of times people might not go to get their diabetes checked or see if they even have diabetes, because you know, there's a study that says that there are millions of people walking around with diabetes who don't even know it. But they will come in because they're having issues with their feet. So oftentimes you end up diagnosing those types of things.
That's exactly right. In fact, that process takes 10 to 20 years, as I mentioned before. And what's happening is that the nerves are being choked, and the circulation to the nerves is being choked down, and they're not healthy. And so that causes the symptoms. How often have you fallen asleep on your elbow and your hand goes to sleep? That simple little short period of time there. So these nerves changing their health inside, where you have the caking up of the sugars. The sugars are horrible for our nerves. Adds to the outside compression of the nerve, and then internally that sorbitol change increases the pressure inside. So now these nerves are being compressed, you see.
Is there a way to reverse that?
That's the whole thing that we do. Yes, there is. There's absolutely paradigm shifts in our profession right now. It's very exciting. This has been going on for really 2 or 3 decades. Started out by a guy named Lee Dillon at Johns Hopkins, who trained me in this surgery. And he started out with patients who had carpal tunnel. They were diabetics, and he would release the nerve here. If you're looking for the tunnel for these fingers, it would be here, carpal tunnel. The ulnar tunnel would be down here for these fingers. Well, he would release diabetic tunnels, being a hand surgeon at Johns Hopkins. And the diabetics would say, "Dr. Donnelly, can you fix my feet?" And he went, "Well, no, I don't fix feet." That was three decades ago. Now there's a whole new system.
Because it's kind of similar in the way you would address that.
It's exactly similar, because we have tunnels in the lower extremity now that we can release. For example, we call it tarsal tunnel behind the ankle. We have a fibular tunnel just in the calf, and then the lower leg, other tunnels.
And we're taking a look at kind of this graphic right here. You're taking us to medical school. I could probably practice after this, but yeah, and looking at that right there.
Exactly. These are drawings of tarsal tunnel. You see, we used to think it was just one ligament. Now we know it's like 4 different tunnels here, and we're in literally every week opening these tunnels and restoring sensation to the nerves, because it opens up the vessels in the nerves. They can start that, what we call axoplasmic flow, which is just the proteins that make nerves work, kind of like water in a hose. And if you pinch a hose down, it's going to end up with little water at the other end, and your grass will die. Well, your nerves die if you choke down nerves.
What I like about this treatment is that, you know, we hear a lot about medications to do things, and sometimes there are medications that cure things. There are other medications that just kind of help you maintain. And what you're really trying to do is just get rid of it.
Exactly. And we can't help, not everyone that's a diabetic or that has neuropathy can have these procedures. We have to diagnose them properly, and we go through a good hour to 2 hours of diagnosis and testing to try and find out if people are a candidate for these procedures. But that's an excellent point.
And once those procedures are done, oftentimes are they
80%? 80% get their restoration of sensation, and that 24/7 burning pain that you can't sleep it goes away. We actually phase neuropathy now, 1 through 5 phases, which makes it really nice because everyone knows that it has neuropathy. You can ask them, how long have you had this and how did it go?
Right.
I show them this phasing bell graph, 1, 2, 3, 4, 5 phases, and the very beginning where you're just starting to get the tingling and burning and things like that, accelerating to 2, and in 3 we're 24/7 burning pain.
Burning, yeah.
And they'll say, well, I'm 2, I'm 3, I'm 4,
Yeah.
whatever. As you go ahead.
I was going to say, is this one of those things that the earlier you get to it, the better the results?
Exactly, because we in the past, it's been thought, and even today very much, that you can only treat these conditions with medicines. Well, and so you're on Lyrica, Cymbalta, and Neurontin for the rest of your life until your nerves basically numb out and go dead on you. When they go dead, now you're on the back side of that curve. That's where ulcers, infections, and amputations occur in the diabetic. So we want to get there before you get to that point.
And just solve the problem.
Yes.
All right. Thank you very much. For more information, you can contact Dr. Parker at 281-497-2850, 281-497-2850, or visit them at Houston's Foot and Ankle Center.com. For other medical needs, you may also call Victory Healthcare at 855-204-7246, 855-204-7246. They have doctors who practice in just a wide range of medicine. Or again, you can go footandhandpain.com. All right, in honor of our Rodeo Week this week, don't forget to log on to Facebook and let us know, what Rodeo Houston event are you most excited about this year and why? I actually like all of them, but I just for some reason think that I need to ride a bull before I exit this earth. And Dr. Parker, you let me in on a little something. What'd you say?
I shouldn't have told you. No, when I was in college, like an idiot, my roommate talked me into putting $3 down and signing up to ride bulls in our rodeo at the college.
And you survived, though.
I survived it, but when you stand on top of a 1,000-pound animal and he does this and it feels like steel under you, you're going, what am I doing here?
Okay, well, we're glad you're still with us. All right, thank you. Sharing a bed with a snorer can be a major challenge.